Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Anovulatory bleeding. In anovulatory bleeding, there is absence of progesterone, which leads to weak proliferation of endometrium by estrogen. As a result, the endometrial shedding is seen by estrogen. This is seen as estrogen breakthrough bleeding with heavy, painless, and irregular menstruation. On ultrasound examination, you will see presence of thickened endometrium. Management. Management is progesterone takes some time to work. So in case of excessive uterine bleeding with ovulatory cycles, you will have to give high estrogen doses. High doses of estrogen as treatment. Estrogen upregulates the progesterone receptors on endometrium, and thus progesterone can act only on endometrium, which is primed with estrogen. On ultrasonography, you can see thick endometrium. Thick endometrium primed with estrogen can be seen. Progesterone, if thick endometrium is primed with estrogen, progesterone acts on the endometrium directly. On ultrasonography, if you see thin endometrium, that means the endometrium is not primed with estrogen. In such cases, first you should give estrogen followed by progesterone.
So if we see thickened endometrium in anovulatory bleeding, if thickened endometrium is seen, then it suggests that it is already primed with estrogen. So we can directly continue by giving progesterone. But if it is a thin endometrium, then first we should give estrogen and followed by progesterone. So here, if it is a thin endometrium, that is when we will start with high dose of progesterone. If it is a thick endometrium, we can directly start with progesterone directly.
thank you and thank you for watching.